My perspective of palliative care is that we are support along the journey. We work with patients who have serious medical conditions, sometimes life-limiting medical conditions, and our role is to make that experience as easy as possible for people. So that can look like symptom management, helping with pain, nausea, constipation, anxiety, depression, all of those things that make somebody feel bad while they're going through a disease or disease treatment. But then also just being there to help share the load, being a sounding board to let people express the difficulties and stressors that are happening with their lives, and then really working with the rest of the team to try and meet those needs as patients are able to share them. What I've come to realize is that every patient encounter, palliative care looks a little bit different than the person that I saw before them. So there's no one size fits all. When I'm seeing you as your palliative care doctor, I'm coming in to find out what you feel like your needs are and to try and help with those. Being able to work at one cancer center that has medical oncology, gynecologic oncology, where people can get their treatment infusions at the same place, they can meet with social work at the same place, there's nutrition there, there's radiation oncology, all under one roof. When I'm sharing patients with my colleagues, I can walk down the hall and talk to them about what's going on with their patients. We can come up with clever plans together for how to meet people's needs the best way. And being at a place that is the size of Compass, you can really know the people that you're working with. So after being there for a couple of months, you realize that, oh, I know the names of pretty much everybody that I'm interacting with, going from working in really big hospitals where you're just a face in the crowd and so is everyone else. It feels really isolating. So here, I finally feel like I am part of a team and really know my teammates. For our patients, they get to have experts in every aspect of their care and know that all of those experts are talking to each other. So we've got brilliant minds with oncology treatment, brilliant minds in radiation. You've got awesome resources with social work and nutrition, and then I get to step in and be a part of that team and help out with symptom management, trying to improve quality of life, making sure that everyone is communicating the same sorts of things to the patient and everyone's on the same page. That situation, just really being so collaborative, is extremely innovative in this type of patient care. I think the thing that I love most about my job is the people, and that's my colleagues that I get to work with that make coming to the office fun every day, but then also the patients that I'm getting to know who are always inspiring me with just their stories and resilience and courage and determination and vulnerability. We're talking about serious medical conditions and sometimes things that are really reducing people's prognosis, and they're having to deal with getting that difficult news and figuring out where do we go from here. And so even if you're able to just pivot things a little bit and get someone's symptoms under a little bit better control, help them walk a little bit easier, help them be able to sleep through the night a little bit better, help manage depression just a little bit better, all of those things add up. And being able to see someone come back a week or two later and just say, you know what, I was able to do this thing that I wasn't able to do before, or I ate this food and it finally tasted like it's supposed to again. All of those little successes really add up. Just the fact that people are willing to let me in and let me try to help out with those things. I think that that's just a really incredible feeling and makes my workday awesome.